And we're really excited to see you all next week and talk hepatitis B and lobby, do some lobbying, or advocacy, I should say, or educational visits. So, if Pavitri, can you just switch the slide? So today we're just going to go over what's going on right now, what we're going to be discussing in our Hill visits and our top asks. We're going to go over what the meeting schedules are going to look like, not specifics as to what each individual schedule is going to look like, but just overall. And also our strategy this year, which is going to be a little bit different from last year. We're going to go over the anatomy of a Hill visit, which you may or may not have heard before, and briefly go over how you all can prepare for the Hill visits next week on Tuesday. So, actually, just a reminder, so we are going on Hill visits on World Hepatitis Day and in the afternoon. And in case I forget to tell you this later, we encourage you all to wear your T-shirts when you're going on the Hill. We know that you all may want to dress fancy, and often we tend to do that for Hill visits, but we just want to show solidarity by wearing the same T-shirts and show that we're all a group, because we've heard several times from staffers that that those kinds of things, like those little things like wearing T-shirts or wearing pins, whatever it may be, really make an impact, and they notice more. So the asks that we have for July, one is the appropriations ask. For 2016, we want legislators to support the President's budget of $62.8 million. And that money is going directly to the CDC's Division of Viral Hepatitis. At this point, the appropriations process is pretty much stalled. We could go into details during the Q&A period if you all want more details about it. But we're going to be having meetings with key appropriators, and we really need to stress how important this funding is for viral hepatitis. And something I would add when you do talk to appropriators is just saying how important it is to prioritize hepatitis B within the CDC as well, because that's something, as you all know, we have a lot of issues with. So that's our first ask. The second ask I'm going to go into soon, just about the USPSTF Hep B screening guidelines and implementing those guidelines within states. And then the third ask is a potentially easy ask, but you would be surprised how many legislators are not on the Congressional Hepatitis Caucus. So we want to make sure that as many legislators can get on there as possible. And the purpose of the caucus is just to have, there are so many similar groups, but it's just to have people, legislators with similar interests, come together and talk about the issues. And the hope is to get them to push viral hepatitis priorities, and we in DC would work on setting those priorities with the caucus staff. Next slide, please. Okay, so I did mention this a little bit earlier. So we're discussing approps for fiscal year 2016. And as I said, right now things are kind of stalled, but the committees, the health-specific committees on the House and the Senate side are in negotiations, what they call markups right now, of the bills. So just so you all know, there are 12 bills for appropriations. The health-specific bill tends to be the last bill that is negotiated, which means that we get the bottom of the barrel in funding. So on top of that, we have to fight with, it's frustrating because we have to fight with other health programs with other health issues, but that doesn't mean that we shouldn't yell as much as we can. So again, the ask that we have is for $62.8 million for CDC's Division of Viral Hepatitis. Some things to stress are that funding will potentially go towards a national surveillance program, which, as you all know, does not exist and is incredibly frustrating for us to be able to prove how much of an issue Hep B and Hep C are in the country. There is specific language the CDC had written on eliminating mother-to-child transmission, which is great. And also funds would go towards building capacity and strengthening local capacity. So potentially that money would go to you all as well. So next slide, please. So here's the more complicated one. You all likely know about the U.S. Preventative Services guidelines and hepatitis B screening, which were released. The final recommendation was released last May and was given a B grade. So all task force recommendations that are given either an A or a B grade under the ACA, the Affordable Care Act, say that those preventive services should be provided with little to no cost. But the complication of that is that would be under this health insurance marketplaces, but we still, on the advocacy side, need to make sure that both Medicare and Medicaid are also covering it at no cost. So on the Medicaid side, I'm leaving the Medicare side out for now because that's something that we're doing. We're working on administrative advocacy on the Medicare side, but on the Medicaid side, it depends by state. So the link on the last bullet point, find out your state status with the USPSTF, that link leads you to a slide presentation that we presented a couple of months ago, I think in May. And it includes a table which includes all the Hep B United States, so like all of your states and whether your state has applied for, received federal funding for preventative services. So you need to check whether your state is providing for preventative services, and if not, then the idea is to lobby your legislator to push them to get the state to cover preventive services. So, sorry, that may be confusing, but I'm happy to answer any questions. Hold on 1 minute. Oh yeah, so if you are in meeting with leadership as well, we are scheduling visits with leadership on the House and the Senate side. This is something to talk to them with as well, because they have a lot of weight to ensure that the governor of a state would be able to apply for federal funding to cover preventive services. Okay, go ahead, Tracy, next slide, please. So the last thing I mentioned earlier is asking your legislator to join the Congressional Hepatitis Caucus. And when you're in your visit, you can ask your legislator to contact Congressman Honda's office, specifically to contact KJ, to get him to connect the two offices and to make sure that your legislator is on the caucus. So that's a pretty easy ask. Next slide, please. So we just wanted to reiterate that these Hill meetings, I know they can often be quite intimidating, but it's our responsibility to educate our representatives on what's happening on the ground level and to also suggest solutions to that. But also it is their responsibility to represent us. So they're there to serve us, and we need to make sure that they're reminded of that. So that's something that I always like to keep in mind when I'm on Hill visits, that we're not there to serve them. Next slide, please. Okay, so you all probably know this already. So we are, each of your states have 2 senators, and you all have 1 representative for your district. We are doing something different this year than last year. We are not setting up meetings with all of your representatives. Some of you may be meeting with your representative and your senators, but we're trying to be more strategic depending on those asks. So looking at key appropriators, looking at Senate and House leadership, looking at those states that are lagging with the USPSTF guidelines. So we're trying to be really strategic, particularly as many of you have done these Hill visits before, which we love, and we want to make sure that we're acquainting ourselves with different offices, and we're not reiterating the same points over and over and over again to the offices that are already our champions. We are also meeting with bipartisan leadership, so on the Republican and the Democratic side. So that's exciting, a little scary, but exciting, to show what our priorities are and push them to start thinking about that. So I'm going to, Pavitra, if you can switch the slide, I'm going to hand it over to Christine, who will go over the anatomy of the Hill disease.
Hi, everyone. I'm going to be going through this relatively quickly. So if folks have questions, please feel free to ask them once we're done and we get to Q&A. So for some of you, this might be new. Others of you are well-versed in Hill meetings and what they involve. And this is just sort of an overview. So you all will get there. You will have a lead assigned to your group. That doesn't mean that that's the only person who speaks. That's just someone who's there to sort of facilitate the conversation and keep it moving. So you'll all, of course, introduce yourself, where you're from, especially if you are from a given person, state, or district, and give a brief overview of just what Hep B is and what Hep B United does. So these folks, some of them will know a little bit about hepatitis, some won't. A health portfolio is enormous, so they have people coming in to talk to them about every condition under the sun, so it's hard to keep track of all those. So just a quick overview to make sure you're all on the same page is great. Most importantly, you're going to want to tell your story and think about that before you get to that office, but we'll talk about that in a little bit, and discuss the work that you do and why hepatitis B impacts you, impacts your work, and impacts their district or their state if they're in the Senate. Of course, it'll ideally be a conversation. So, the best case scenario, they're going to be asking questions and be really engaged. Worst case scenario, they will be polite and maybe not have so many questions, but that's okay. And of course, you will sort of end with introducing your asks, the ones that Isha just went over about, being sure to support funding for CDC's Division of Viral Hepatitis, ensuring that their state is taking full advantage of no cost sharing for hepatitis B screening and vaccination, and also that it'd be great if they join the Hepatitis Caucus. So you'll all have packets that will have a bunch of information for the staff that you're meeting with. It depends on the staff, but I sometimes recommend that people leave packets at the very end. If not, they can tend to get distracted reading the materials inside and sort of lose track of the conversation. And we all do this, so it's just one way to sort of keep the conversation focused on what you want to talk about. You'll have time on Monday to meet with your groups, so don't worry, you'll have time to practice if you want, and you'll get your schedules well ahead of time. You'll get those on Sunday, so you'll be very prepared. I think one of the most important things, and Isha sort of alluded to this, and it's easier said than done, but it's important to try not to be nervous. A lot of the staff that you're going to meet with are young. They might be younger than you. That's okay, and that's normal. If your room is not ready or it's busy and you have to meet sort of in the waiting room or out in the hall, just remember that none of those things are in any way sort of a sign of disrespect to your issue or to your group. This is just a really busy time, so all the members head home in August to work just in their home districts. So staff are really busy wrapping up work for their bosses at this time, at the end of July. So just try not to be nervous. They're just, you know, young people learning about things, and you're definitely the expert in all of these cases. Okay, next slide. Here's a lot of information that a lot of you probably already know. There's no need to memorize this. A lot of the information is going to be included in your packets. You'll also have this slide to look back on and reference. These are just some facts that you'll want to bring up. Data is really important to show why there's such a great need, and we don't have a problem with that. We could use more data, but we certainly have an enormous need in hepatitis B. And if there is one thing that you want to remember, like Isha said, there's no national surveillance system in place, which is enormously problematic and puts us in kind of a catch-22 almost. You can't get money without numbers, but you can't get numbers without money. So it's really, really important that we're able to get, you know, the appropriate epidemiology because it's sort of what keeps us honest in public health, and it's what keeps our programs honest and responsible to us when we're able to show sort of what an enormous burden we have, and ideally they will allocate resources accordingly. They haven't to this point, but that's what we're trying to change. All right, next slide. Okay, tell your story. So this is one of the most important parts of the meeting. It's really what is most compelling. It's why it's so important for you to meet with your members' staff here in DC. This humanizes the issue. We can go in all the time and talk about data, but they really want to hear about you and about your home and your community and why and how hepatitis B impacts your lives, right? So think about sort of how you want to talk about that, what exactly you want to say. It helps sometimes to write it down in advance. We will have a little worksheet available for you when you get here in DC to help you sort of frame your story and outline it and practice it, because I know if I don't practice my story in any situation, I will just sort of ramble for a really long time, and all of a sudden, you know, 10, 15 minutes are gone. And it's very easy to do that, especially when you're nervous or talking about something that gets you sort of fired up and angry, right? So you'll want to definitely think through that before you go and practice, ideally. These visits are always very short and sweet. That's normal. That's also sort of not putting you off or disrespectful in any way. 15, 20 minutes is pretty standard. So you'll definitely want to practice to make sure that everyone in your group has a chance to be heard. So that's something that we'll probably talk about once you're here in DC also. Next slide. Isha just went over these asks just to remind you so you get sort of a feel, and the more you see language, I think the easier it is to remember, but we'll have fact sheets in these packets that will explain more about what the $62 million will go towards, what the funding has been historically, which is half of that, sort of what the USPSTF guidelines are and why, and information for getting their members to join the Hepatitis Caucus as well. Next slide. Okay, afterwards, you know, follow up with staff. It's really important to continue those relationships. It's important for us to be able to continue building relationships after you're gone. Ideally, you're able to build your own, but we understand that not everyone has the time to dedicate to that. But really, even if you're not following up with additional information, which they may ask for, it's really nice just to get a thank you for their time. And that is just a really important sort of courtesy that we always try and do, ideally within 24 hours. Send them an email. They should offer you their business cards before you leave, but if they don't or happen to forget, just ask. They have stacks all over the office. That's what they're there for. And your meeting leads will have a feedback form for every visit, not one for every participant, so just one per visit. So you'll just want to make sure you identify who is responsible for filling that out and getting back to Isha. So I know she'll really appreciate that. Next slide. Okay, so just before the meeting, you'll find out who you're meeting with. And since it may not be a member that represents your state or your district, it'll be helpful if you don't know much about them to learn about them a little bit. Google them, see, how they're coming up in the news recently, check out their website, see what issues are priorities for them and how you might be able to connect the issues that they already care about to the issues that you're facing around hepatitis B. It's really important to be on time for these meetings. I know that probably goes without saying, but their time is very short often. So if you're going to be late, that's okay. Make sure you call the office and let them know. The schedules that you'll be provided with will have those office phone numbers. The stories that you tell are really important. The data that you give is also very important. But just remember that it's okay to not know an answer, right? So if you're asked a question and you don't know, just tell them that you don't know, but you'll get back to them with that information. And if you don't have it, Isha or someone will help you find it and can circle back to that office. It's really tempting. I'm tempted sometimes to just sort of make up an answer just so you have an answer, but that's definitely not the best way to go. And sometimes it's actually nice to be asked a question that you don't know or something that you can pretend not to know because it gives you an excuse to follow up with them later and an easy way to continue the conversation. And then again, practice your story, whether it's in the mirror or with one of your colleagues, or just pull one of us aside if you want to do that, especially if it's your first time and you're feeling a little nervous. Next slide. Thanks so much for listening.
This is Isha. I just wanted to let you all know that we know that some of you may be doing this for the first time, and we are being very mindful to ensure that the new folks will be paired with people who are more experienced with the Hill visit, so you won't be on your own. We also wanted to let you know, just because we're being more strategic this year, that there are going to be fewer Hill visits than we had last year. So some of you may only be going on one Hill visit, so you just have to make sure it's good. And Christine had mentioned this, but there will be leads for all the visits. You will know whether you're a lead. All the leads have had experience with Hill visits before, just so you know. But you will know whether you are a lead on Sunday when we all see each other. And the last thing is that Christine was talking about follow-ups. We say to CC me, that's Isha, on communications that you have with the staff, just so I know that you followed up with them, and that's just in the case that if there's information that I need to provide them, I can do so, and also to follow up with those folks that we may not have together, may not have had a chance to follow up with, so just so I can keep track. So that's it. So if we could open it up for any questions you all might have, we're happy to answer them. Okay, so we got a question from Ben about confirming the prevalence rate of 1 in 10 or 1 in 12 APIs has hepatitis B. So the CDC says that it's 1 in 12, but we go with the 1 in 10 number. And the reason we do that is because we know that 1 in 12 is an underestimate, and the 1 in 10 number is something that the CDC acknowledges. They just haven't published it on their website. So if you feel more comfortable using the 1 in 12, you can, but we go with the 1 in 10. Another thing that I did not mention was that for those of you who may not have a visit scheduled with your legislator, but you want to visit the legislator, we will have folders for you to do drop-offs. So you absolutely feel free, and we encourage you to do a drop-off, a quote-unquote drop-off, which means just dropping off a folder with the staffer of your representatives or senators' offices. Oh, okay, so there was a question about resending the slides that for USPSTF. I will absolutely send you the link right now, and I'll put it in the question box or the Q&A box. There's another question about sending out a copy of the PowerPoint. Yes, this is recorded, so yes, we will have a recording of this presentation.
I mean, as much local data, so to what extent should we provide local data was the question. As much local data as you have is great, assuming that you're meeting with the representative of that district. But they love as local as you can get. I think those are all really, really helpful numbers, really helpful anecdotes. So I would bring whatever you have. And if you have materials from your organizations or what have you that you think would be valuable, go ahead and bring those, and you can always add them to the packet.
Yes. As Christine had said, staffers love stats. So
if anyone has raised their hand virtually, if you could type the question in the chat box, that would be the easiest way for us to get it. Thank you.
Do we have any more questions? Karen?
I think there's one more question, Isha. It's asking, to what extent should we provide local data?
We just answered that question. We were just saying that as much local data as you can provide is great, because staffers love local data. So there's a question about the 1 in 20 number that's infected with Hep B, and that there's one. Sorry, the question is, it says 1 in 20 are infected with Hep B. I've always heard it's 1 in 4 of those who have chronic Hep B. I haven't heard that stat. I've actually heard that it's 1 in 4 will die of liver cancer or cirrhosis. Yeah.
Give us a second. We're bringing up the slide on our end so that we make sure that we're talking about the same thing. Okay, so 1 in 20 Americans overall, 1 in 4 Americans would not be infected with hepatitis B.
Yeah. So it's what I've heard, that it's 1 in 4 that will die of complications of liver cancer and cirrhosis.
Of the people who are already chronically infected.
Correct.
But 1 in 20 Americans overall, of every American who lives in the United States, that's what that number references. Is that helpful? or are we answering the wrong question?
Okay, hopefully that was helpful. So we have a question about zip codes. We can definitely talk to whoever who had posted that offline. We'll get back to you about that. We're just to let you all know, we are going to send you all a copy of the slides, and there will be the recording will be available for you all as well, just in case you want to go back to this. Do you have any other questions? Okay. Even though we're gonna end the webinar, but please feel free to reach out if you have any additional questions. Otherwise, you'll see us on Sunday, and you can, of course, come up and ask whatever last-minute questions you might have. And you will get the materials, all the materials that Christine had mentioned on Sunday as well. So we're really looking forward to seeing you all. We're excited to have the summit together and also to go on these Hill visits together on Tuesday. And hope you all have safe travels and a good weekend. Thanks, everybody. Thank you.